I am Jonas Rapp. 3 months ago I got stroke and I've had aphasia since. See this movie to see what's working today, tomorrow and in the past. Started in February. We had a great week that's just awesome. We were going skiing up north in Sweden for Hemavan, the place I loved all of my life, exactly. Me, my wife, with Linda, and four of my kids this year went there with us, and everyone was loving the skis, and they got to be getting whatever they're doing. They ski better now, and they improve every time we go there. Well, that's except me, because I'm not getting any better now. I just love that so much. After that week in Hemavan, we came home late Sunday, and on the Monday, the 15th of February, I was working for one day, working from here at home, of course. And in the evening, I was working and trying to get to pair with the Scottish Summit. After that, I went to bed and fell asleep just like normal. At 3 a.m. I woke up. It sort of felt a bit strange. Something strange with my right arm didn't really work. It's okay. So I went to the bathroom, realized I need to wake up so I don't feel strange, but so I start feeling good. Then it was still strange to me. So after that, I had to wake my wife, and she woke up, and showed up. I didn't speak. I said something. I was going to say something great, and it just came. That's what I was going to say. I was saying one thing, but the thing I came out here didn't look like that. And also, you see, so the left eye looks a bit strange. Makes it like this did. For Linda to understand that this is serious. So she calls the 112, and it doesn't take much to repair on me. And then they came here with the ambulance, and they made a quick look, checking me out at home. When they did that, about around 4 a.m., then I was actually spoken, and everything was then good again. Came with Linda when I tried to speak to her, but then when the doctors came here, it looks just okay. I could talk, and there was no problem with that. Anyway, of course, they took me away to the doctor. So, of course, they took me to hospital. Came there at 4:30, maybe 4:30. And all the doctors, they came to me and to check up everything. They were checking with the brain, and they were checking with everything, how it looks on me. Oh, the headache killed it in my my brain because it hurt so much there. Actually, I don't really remember much they did at that time, but I think as about when I get some lunch, and the headache was actually getting a bit easier. So then it felt okay again. So I brought my computer up, and I was working a bit, and I was even joining with the Teams call with my colleagues, and everything was then fine. I figured, well, my small things I've eaten, so then my head feels okay. Before this day, I had probably never seen any doctors. Well, except for my sister, Åsa. She's a doctor. So, of course, then I called her on my phone, and I kind of told her what's happening, and she found it out some way. So before that, I've also called her now today for her, and will let Åsa says what she knows.
Well, we're 3 months ago, I think today, 3 months ago.
Oh.
It was a Tuesday, and I was at work, and you called me. I was a bit distracted. I was probably in the middle of something. But I heard the word hospital, and then I was completely focused, because I know that you won't set your foot near a hospital if you don't have to. So this was serious.
Okay, so then you're not talking to your brother just like that. You're talking to a guy at the doctors, and you want to see what's happening, really.
Yeah, my brother is a patient.
Yep.
I realized that. You told me you sounded quite okay. You sounded just like you used to. But you told me that you woke up that night and realized you couldn't use your right arm. You tried to tell your wife, but the words didn't come out as you planned. I think you said, I tried to say chair, but I think it became bicycle instead. You told me your arm was a bit numb. You felt differently. Cold and warm was not as you was used to. But you sounded fine. And at that moment, I realized, okay, this must be a stroke. And I was happy because you were in the hospital, and I was extremely nervous, of course. And since I'm a radiologist, my radiologist part of brain started thinking, what has happened? How did it happen? Why did it happen? But then
I still have no why to had it anyway. So
me neither. But then I have this sister part of brain that wasn't quite that structured, more chaotic. But I started thinking about the causes of stroke while we were talking. And I tried not to tell you about what my mind was doing in the background, but I needed to know why, how and why did this happen. So I was thinking about cardiovascular disease. It's not that common in our family. Eurythmia. You're a fairly well-trained runner. You would have noticed if your heart didn't beat as it should. So I didn't think was that. Maybe you had hypertension. I don't know. There are a number of lifestyle-related causes. I rejected them. And after a while you told me, oh, I made this CT scan. And they said that the CT scan of the brain was blank. They couldn't see anything. But there is, I think you used the word stop. There's an occlusion in a vessel. So, okay, my radiologist brain kicked in again. He's made an angiography of the vessels in the neck and brain. So what causes an occlusion? I knew what vessel because I knew your symptoms. So I knew it was the left carotid artery. And the only thing I could think of was an anomaly, not that common, dissection. That's when I started to ask you about if you had had an injury during skiing the days before.
Yeah. I don't fall from doing the skis, of course.
Of course not. Sorry. Silly me. But that was the only thing I could imagine, that this was a traumatic dissection. Because you're young and you're healthy and you don't, this doesn't happen to you. You told me at that time, no, I haven't had any I didn't fall, but I've had this incredible neck pain. And I couldn't see the relationship between the neck pain and your stroke. Not until days later, after the surgery and everything. Then I realized, okay, this is a dissection, and it has probably been going on for a couple of weeks because you had this pain. But I think my sister brain just mixed things up. It took me days to understand that this was relevant. Afterwards, I've been thinking, I remember I told you, make sure they don't send you home without having a plan. Maybe
you mean to push what I mean the thing that actually that I got the scrote. Yes. Scrote. I can never say scrote, right? But that I got that because we still don't know why I did get it. No. And they're gonna look again quite soon to after 3 months they will look again on to everything to see what's the change in me and see if there is possibly the actual know why I got screwed. Yeah. It was all day, everything happened. Starting at 3 a.m. and now at 5 p.m. about, was actually talking to one of my sons, Lucas. Also, he had him on the phone and got some dinner to eat something from at the hospital. And then it struck me. The stroke had bit me really hard. Actually, Lucas was still on the phone. He heard what happened on me, and he heard all the doctors coming, trying to take care of me before Lucas, my son, just had to, he stopped talking to me, and then instead he called my wife.